Hi, my name is Amy Toonstra, and I'm here to present my research entitled Effects of Pressure Threshold versus Dynamic Flow-Resistive Inspiratory Training on Respiratory Strength in Healthy Adults, a randomized controlled trial. My co-authors for this study were Andrew Jacobs, Nicole Sperling, Nathaniel Richter, and Olive Westberg. So as a background, we know that inspiratory muscle training, or IMT, is an effective intervention to help improve inspiratory strength in both clinical and healthy populations. Interestingly, though, there's a lot of different devices on the market, and all types have been used in research. So, for example, I have a pressure threshold device here. This is a spring-loaded IMT device that just provides constant resistance anytime you take a breath into it. In comparison, this is a dynamic flow-resistive device. It's computer-operated and is much more expensive, but does more individualize the resistance to the flow and rate of the breath, and has been touted to be more effective because of that. However, there hasn't been any research to support differences in effectiveness between the devices. So the purpose of our study was to compare the effectiveness of matched volume IMT delivered via either a pressure threshold or a dynamic flow resistive loading IMT device on inspiratory strength in healthy adults. For our methods, we had 20 healthy adults who were enrolled in our study, and it was a single-blinded randomized controlled trial. Baseline inspiratory strength was measured via S-index, which is like a dynamic measure of maximal inspiratory pressure. And this was assessed prior to randomization into either a pressure threshold or a dynamic flow resistive group. Both groups performed the same protocol. They did 5 days per week for 5 weeks of training, 30 maximal breaths per session at 50% of their baseline S-index, which is comparable to their 1 rep max. Inspiratory strength testing was then completed again at the end of the study, and we used repeated measures ANOVA to look for differences pre and post-training inspiratory strength, and then also between groups. So what did we find? We found that both the pressure threshold and the dynamic flow resistive IMT groups had significant improvements in inspiratory strength at the end of the 5 weeks. Interestingly, though, there was no group by time interaction, indicating that both devices were equally effective at improving inspiratory muscle strength. Because of this, it appears that the load that's put on the inspiratory muscles may be more important than the type of delivery and the type of device that you use. What's interesting and helpful about this information and our findings is that now clinicians can choose whatever device they want based on patient preference, affordability, and accessibility, with the knowledge knowing that they will have similar results regardless of what type of device they're using. We hope these findings are interesting to you and helpful to you, and we thank you for your time.